currently, the response assessment in myelodysplastic syndrome is based on the International Working Group criteria, which were published in 2006 and have not been revised since then. And what we have noted, especially now, but also with hypomethylating agents in the past, and now with the combination of hypomethylating agent with several novel agents, that there might not, those response criteria may not really represent meaningful clinical benefits that are seen by patients. So, for example, there had been large retrospective analyses that basically showed that patients that do not meet the formal response criteria of a complete remission do see a clinical meaningful benefit in terms of hematologic improvement. So we conducted a retrospective single-center analysis where we analyzed our outcomes in patients with MDS that were treated with frontline treatment with hypomethylating agents, so azacytidine and decitabine. And that was done at Yale, and we analyzed patients that were treated over a 9-year time period. And we found 100 patients that met our inclusion criteria. And what we found here was that we had, unfortunately, we had a very high risk patient population with almost half of the patients eventually progressing to AML. And when we analyzed the outcomes based on the formal IWG response criteria, we found that patients who achieved a complete remission based on those very stringent criteria, they had a statistically significant overall survival benefit compared to other patients. However, when we then look at a response category that's currently included in the IWG criteria, which is called marrow complete remission, or MCR, and this is often combined with true complete remission as an overall composite response assessment. Those patients were not seeing a similar survival benefit compared to those with complete remission, but those patients were actually behaving very similar to patients who just had stable disease, which means like they're not responding. So I think that was kind of the not an unexpected finding, but I think it lends support to additional efforts to revisiting the formal response criteria. And based on this study, as well as others that have been presented, there have been other abstracts from the MGH group in collaboration with Moffitt that showed similar findings. There have been efforts launched to evaluate a response criteria that's called CR, complete remission with incomplete hematologic recovery, or CRH, which has been pioneered in clinical trials in AML, but it's not been really validated in MDS. So that's something we're going to look at in the future and see if that could kind of combine the benefits of complete remission, but also some meaningful hematologic improvement like transfusion independence and reducing the risk of infection. And that's something we're going to evaluate in a large international retrospective collaboration, hopefully in a very soon future.